All right. All right. All right, folks. We want to say welcome, 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 welcome. This is Healthcare and You, your usual program that is brought to you by your humble host, Alvin D. McKay Sr. And today we have two amazing people in the house, right? So this program is going to be wonderful. But before we start the program, we'll just play our theme song, and while we share the video to as many persons as you can. So we'll play the theme song for like 1 minute, 1 or 2 minutes, and then we will be right back here to get the program going. So while we already live, so just share the video to as many persons as you can because this is a new platform. We want to reach more audiences. So please just share the video as I play the theme song for like 2 minutes. Thank you.
Let's see if it's
All right. So again, we want to say a big welcome to all of you in Facebook land, YouTube, or whatsoever social media platform you're using. This is Healthcare and You. This is the platform where we discuss healthcare related issues. And I am your host, Alvin D. McKay Sr. And I have two amazing people in the house today. Miss Alice Kuhn, my former classmate. We graduated from the Lions Den together, and she has with her Miss Juliet Silvio, right? Silvio, am I correct?
Sylvia. Yep.
All right. Okay, I thought I was wrong. I'm so bad with names.
No,
So
you're good.
we're here today to discuss some amazing issues relating to our country's healthcare system, and so we invited them to just speak to us a little bit about what they know and how best we can help develop and improve the healthcare system back home. Because, like you are aware, that we've been discussing, looking at the system in a holistic view. And like I always tell people, this is not a political platform, and healthcare has nothing to do with politics. It has nothing to do with who's the best educated person or who's the best party or who runs the best party in Liberia or elsewhere. But it affects everybody, and it should be everyone's concern. And so, with that in mind, we thought it wise to come up with this platform to be able to address some of the critical issues that are affecting negatively on our healthcare system back home. And so, we are here today, and again, we will now just get the ball going. We're already 10 minutes behind time. We should have started at 5 o'clock. We are 10 minutes behind time, and so we'll get the ball going. We just open the floor. We want our guests to introduce themselves. With allot 2 minutes each. Just say a little bit about yourself and what you're doing. Thank you.
Well, thank you so much for having us. It's such a pleasure. I'll start off by saying my name is Juliet Parker Seville. I am a registered nurse. I have a background in pediatric gastrointestinal care. I am currently the program coordinator at Unique Health School in Virginia in USA. And I am also the clinical instructor at the facility.
Thank you.
And what's Alice?
I'll tell you to say more. Anyway, my name is Alice Coon. Well, how I be my first name. Well, since I came to the US, everybody referred to me as Alice. So Alice Coon, I am a nurse practitioner, a DNP candidate. I'm also the owner for Unique Health School. It's a medical institution. And I also the owner for Carry Hands of America. It's a home health agency. So currently, I do work as a nurse, and I'm also the director of nursing for the school.
All right. So, folks, you've heard from our studio guests, Miss Kuhn and Miss Seville. Excuse me, I'm going to be missing the name a little bit, so I'm going to call you Juliet, please. I don't want to mess up your last name and get in trouble, so I'll call you Juliet.
Okay.
So please just bear with me with the whole name thing. Yeah. So you've heard just the intro from our two guests, Miss Kuhn and Miss Juliet. And so we will be getting straight into our questions. Like you are aware, we've been discussing how best can we improve the healthcare sector in our country. We've been throwing some bombs. We've been throwing some solutions out there to see who's going to catch it, who's going to take it in, and who's going to run with it. Like I said, this is not a political platform. Because if it was a political platform, we will only be throwing out blames and tackling those who are responsible and stuff like that. But what we do here, what we endeavor to doing is finding solutions. So we identify the issues and we strive to find solutions to what we think are those critical issues that are affecting the system. And so we'll get the ball rolling. Later on, we'll come back to the school because I got interest in the school. I want you guys to talk more about the school, but we'll come back to that. So we will get the ball rolling. So we'll start with Alice. Alice, so when was the last time you visited Liberia? When was the last time?
I've been trying to go at least twice a year. The last time I visited was in March of last year. So I visited last year.
Okay. All right. And what about you, Juliet?
So I've been out of Liberia for quite some time, several years. The last time I was there was 2000.
Oh, 2000. All right. Well, you did well. I think I've been out of there since 2011, and I haven't gone back yet. So, and the reason why I asked the question is that how are you? I'm sorry, Alice.
You could how I took as the same person.
I know, right? I'm so used to the how I. So, Alice, you've been the most recent person to visit back home. So, while you were home, were you opportune to have visited some of the healthcare facilities back home? Just you made a stop by just to ascertain what is going on and stuff. Were you opportune to do anything of sort?
Actually, yes. So the sole purpose of me going back in the first place was to make some assessment because I really wanted to go back home to one open a nursing school and a primary school. So that was the sole purpose of me going. So I did make a lot of research. I did a lot of assessment, and I was able to visit JFK because at the time when I first went back, one of the administrators for JFK is my very good friend, Mrs. Comfort Unitu Cooper. So I went to see her, and we did have a lot to talk about. So I wanted to see how things are being ran, in the hospital. So she told me a lot, and that just gave me a eye opener to some of the things that were going on there, and some of the things that I felt that needed to be changed.
Okay. All right. Yeah. So let's just stick to JFK for just 2 minutes. So looking at, I mean, from your overall perspective, because I've been through a lot of nuggets on those big name hospitals in Liberia, and you and I know, like you said, you visited. I have not visited there, why since I left, but we've been receiving information concerning our biggest hospitals in Liberia, JFK, Redemption, and the big names, and we're told that these hospitals lack so many things,
Mm.
yet they're still trying to function. So, I mean, from an overall perspective, what are some of those challenges you think that they are faced
Well, a couple of them.
with?
And
Okay.
we can't write the name all because, like you say, there's a lot to be done or to be improved upon in Liberia when it comes to the healthcare. One of the things that I saw there that was really disheartening is their CNAs. Their CNAs are not satisfied. There's no competency test that they take to get some form of certificate, but yet they work in the facility, and some of them do give injection or they administer medication, which is way out of the scope of practice. And it's very scary because, take for example, if you're just giving medication, there are so many different sites that you're supposed to give up in appropriate site that you're supposed to give like injection. So if you give a CNA just to give injection, they don't know whether it's supposed to be 90-degree or 45-degree, whether it's supposed to be in your delta muscle, and they just give it anyway. One, they could cause a lot of harm, and they could cause injury to whoever they're giving that injection to. So I was very confused about that. So that's one of the biggie. They got aides in the facility. You and I know in America, yeah, CNAs, you're not allowed to give medication. So that's one thing. Another thing that I saw that was very discouraging is people coming into the facility for help or for care, and they are being sent to get their own medication. So why is the and that was one of my questions. Why is the hospital not equipped with a lot of medication or all the equipment that they need? You got to be
Hmm.
sending sick people or their family member to go and get medication. That was very sad, and that's an eye opener because if you got someone in critical care and the medication or the equipment you need to help them, someone else have to go to look for it. You can That person can die for no reason on a preventable death.
Hmm.
So those are a couple of things. I put some of them down.
Yeah.
One of the things that I did, I talked to a couple of nurses that did not even know what CPR was.
You kidding me, right?
No, I'm not. No, I'm not. I had a nurse that
Wow.
was just about to graduate and did not know what CPR was. That's basic life support.
Basic, yeah.
That's basically how can you save someone, when you don't even know how to give.
I know CPR.
Exactly. Yeah. So I mean that's
Wow.
something that needs to be changed. Like
Yeah.
every healthcare provider
Mhm.
needs to know how to do CPR.
Yeah.
So that was confusing.
Wow. But
A
so
lot of them
let
take
me just
manual
hold you
blood
right there.
pressure.
Let me
Say
just hold you
again?
right there. Let me just hold you right there.
Okay.
Looking at the school, I mean that is so great. So great initiative that you want to undertake, and I must applaud you on that. Let me just throw this out to Juliet. Juliet,
Mhm.
what I mean, from what Howard just explained, her experience with these CNAs and what have you. What will, because we this, this is an important issue,
Mhm.
CPR, right? And we have all of these schools. Remember now, I mean, she's not the only person who has school in Liberia. There are other schools, and I just talk about some of these schools that are putting out graduates,
Mhm.
CNAs and lab tech and what have you. And she just spoke something. I mean, just the basic CPR. So they're putting out these graduates, and some of them don't even know what is CPR. So, what would be your recommendation to some of those schools that are
Right.
putting out these graduates?
And my recommendation definitely will be going back and to the basic, looking at the curriculum. Definitely needs to be changed because there's no reason why you should graduate from whether it's a basic nursing school or a medical facility and you don't know how to give basic life support, because this is something that supposed to be taught in school so that way you can actually teach the families as well, because it's going to help save a life. As we all know here, CPR, it's one of those routine steps that once you learn it, you know the steps to follow in the event that of an emergency, you'll know how to take care of that patient. So I'll say going back to the basic and looking closely at these curriculums that the school is following.
Wow. Yeah, that's so true. And it just took me back to my last podcast. I was talking about um, it's not only students who are graduating without the know-how, but you come to find out, and I don't know if you were opportune to have seen some of these things that I'm about to say, where and even when we're back home, there were these street peddlers that will come around with trucks in their carrier,
Mhm.
and some of them will be so hot and they will be under the sun, and these people passing around and they don't even know anything about drugs, but they are
Yep.
selling
Mhm.
penicillin, they're selling paracetamol, they're selling all of these things.
Right.
What is going on? What is going on? Y'all talk to me. What is
I
going
mean,
on?
First of
I'm
all,
sure
why
I'm
do they
sure some of
have
these things still exist today. They're still happening today.
yeah?
right,
You
And
know
why do they have access to these medications? That's
right.
exactly.
that's number
Yeah.
one. And you got to go back to the hospital. Hospital needs to start having in-house pharmacy where the medication is available at the hospital. The family members should not be taking a script
Hmm.
and getting these medication because we can have mix up where they're mistaking a certain name for the drugs. A lot of drugs have similar names, so
Hmm.
it's a big issue.
And then just to add to that, some of these drugs are controlled substance.
Yes.
In the United States here, you'll see that certain drugs you just can't get over
Over
the
the counter.
counter, but
Exactly.
you will
Yeah.
go in Liberia and get a sack of amoxicillin
Hmm.
or drugs that
Yeah.
are controlled substance, like the Percocet.
Mhm.
You can just go, and if you know where to go, you can buy a whole lot and bring it with you, or
Yeah.
or sell it to other people.
Yeah.
So these are things that I think the health department need to kind of pay attention
Yeah.
to. Take this in from on the street. Because with all
Sure.
that, you'll see that people trying to take the Liberians are taking the shortcut, right?
Yeah.
Instead of going to the hospital where I can go and have my entire assessment done for them to see what's really wrong with me, I'm going to take amoxicillin. Everybody take amoxicillin for everything.
Everything.
Yeah. I'm
Even
one
if
of
it's
those.
not,
That's one of those. I took it for the
I mean,
cool.
I have a Liberian older lady. I mean, she could be having even her toes. She would tell me, "Oh, I want to take amoxicillin." I'm like, amoxicillin is not for everything, you know. But and that is why when we're really sick and really need amoxicillin,
It doesn't work.
it doesn't work for us because while our body have built up resistance to it,
Mm.
so it doesn't work. And it's like, oh, I took the medication, it's not working. The reason it's not working because you're taking it so much, right? And then you stop when you're not supposed to stop, and then start when you get another symptom, maybe stomach ache, you take amoxicillin, you got a headache, you take amoxicillin. So when you really have some kind of infection that really need amoxicillin is not going to work.
Okay. I mean, fair enough. So now this is where this show gets a little bit critical, and people try to link it with politics, but it's not politics because, and the reason why I say it gets so critical is that, from my understanding, in most countries, and like for America, right? America, the government showed us up to 90% of healthcare related expenditure, and I think it's the same with Liberia, according to the budget. So we cannot talk about healthcare without, talking a little bit about what government is doing.
Mhm.
And so when we try to talk about what government is doing, then people say, "Hey, you want to politicize the show," but it's not that. It's only that we want to call the appropriate authorities to know what exactly needs to be done to improve the system. So we have to tell you a little bit about the like all of these things that you just outlined. Like people don't even know what it calls CN how you call it,
CPR.
CPR, and they are out there in the hospital as CNA and nurses and what have you. They don't even know what CPR is or about all of these things. And so um uh the current regime erected one or two hospitals. I don't know if you guys are aware. And one of the latest um buildings they erected is in Bakwolu, where I'm from, my hometown. Bakwolu, a brand new 100 bed hospital. They just erected it, and I'm told that the president himself was there, not breaking grounds, but opening the hospital uh, today. And so we see many of these structures being erected,
Mhm.
but on the other side of the coin, you have limited doctors. I'm told, according to research, that you have less than 100 medical doctors in Liberia, catering to about 4.5 or almost 5 million people. And they're still erecting hospitals, which, of course, that's my hometown, and I applaud government for erecting the building. But what's your take on this particular issue? So many erections of structures here and there. Is it politicizing the healthcare system? What's your take on it? Should government be doing this, or should government be doing uh, empowerment, improvement, and what have you? What are your views on what is obtaining in Liberia? We start with you, Miss Kuhn. Mrs.
Okay.
Kuhn.
Okay, so personally, when it comes to that, what I can say to that, and again, I'm not here to step on anyone's toes. Really don't care about politics like that. But my thing is, you can have all the infrastructure you want, right? You can have like 50 infrastructure. If you don't have people to govern those infrastructure, we're going to end up in the
Back to
exact
square
same
one.
spot. You're going to have unwanted death. You're going to have a lot of malpractice. You're going to have a lot of negligence. I think the focus should be on providing better curriculum for nursing institution.
Mhm.
The focus should be on training medical personnel. Because when you talk about school, I mean, I may be pronouncing this so wrongly. Like you say, what's the name? The hospital is in Bapulu.
Yeah, Bapu County. Yeah.
Now, and you talk about the limited doctors that we have. Think about it. I think one of the only or biggest medical facility we have is the I think AM Dokati
Yeah.
institution, right?
The college. Yeah. Mhm.
Now, how often do people really enter that institution? And even if they do enter the institution, think about it. Maybe they're taking maybe 50% at a time, right? They need to sit maybe like I heard just from talking to people that sometimes it takes maybe years before they can actually test out, or another group of people lost their self and motivation, to continue. So you find out people leaving, going in places like Ghana, Nigeria to go obtain education, and some of them decide to work there instead of coming back home to provide services. So I'm not saying that the infrastructure is bad, but what I'm saying that the focus should be on proper training, upgrading or updating our curriculum for our nurses. We cannot have nurses in the hospital and taking care of patient and know nothing about the patient, don't even know how to take manual blood pressure. So you can have that beautiful infrastructure and you have somebody there that's depending on a machine to read a blood pressure. If the machine don't work, they can't do manual blood pressure. I've seen that.
JFK doesn't even have oxygen. I'm told.
I'm saying that straight up. Like there are nurses that don't know how to do manual blood pressure. So these are the same nurses we're going to take to that facility. BA that is so beautiful, right? But we're still going to have death that's happening that not supposed to be happening because of malpractice. So I don't think the focus is on the infrastructure. The focus is on proper training and proper governing of this, of these facilities.
Yeah.
Like my thing, you want to jump in?
To piggyback on what you're saying, just pretty much making sure that these providers are up to par, like the competency, right? There needs to be a licensing body, like making sure that your doctors, your nurses, your clinical instructors are meeting the proper qualification. Basic life support, basic vital signs, knowing how to check someone's temperature, knowing how to check their pulse, knowing how to do blood pressure, manual blood pressure. These are things that needs to be taught.
And another thing, and I'm sorry if I get a little, right.
Go ahead. I mean,
my daughter warned me when I came. She said, "Mommy, don't get too animated," because I'm very passionate when it comes to nursing, right? My thing is, I would really like to know what's the measuring stick that is in Liberia for someone to just jump on and say, "I want to open a clinic,"
right?
Or to say, "I want to open a hospital." What are the criteria? You know what I mean? Because I see that there's a lot of little clinic all over the place, and then you go there and you see somebody lying like on the floor, and then there's drip hanging on them. Right. Like, what are these criteria? There's no accountability. There's no accountability. People are dying every day, and I'm going to say this because, like I said, I'm passionate about this. I just lost my niece a week ago due to malpractice. Like, she was pronounced dead. She was pronounced dead at one hospital. Meanwhile, she was just in coma. By the time they took her to the next hospital, she had just died 30 minutes. And they're like, "Oh, she was in coma." And there's no accountability. There's no one to hold. It's like, it happened. So it seems like we don't really have the value for human life. If you are in a hospital, you are a nurse, patient. It's because of the patient we're getting paid in the first place.
Sure.
We have to understand not everybody can be the nurse, or not everybody can work in the healthcare field.
I guess just making sure that it goes back to the qualification, like making sure everyone's meeting that basic qualification, right. And making sure that there's a process in place where someone is checking if someone's up to date with these qualifications.
Right.
Yeah.
Okay. All right. So now we everything you all just said, they're all salient. I've been hitting some of these issues for the past week, and some guys jumped at me and said that I was lying, but it's good to hear from others, and this is the reason why I brought you guys in, so that people will hear for themselves from those who are entrenched in the field. So one other thing that I'm hearing, is that back home, the reason why we have a whole lot of mushroom clinics and pharmacies around, is that because those who are close with the administrative authority in places like GFK, Ministry of Health, and other places, these people have their own, interest in opening their own clinics. And so when the meds are taken to, when they are given meds from donors or from their partners, they take them to their personal, businesses. And I'm told that's just what's happening. So you have a whole lot of mushroom clinics and pharmacy. What do you think about these things?
I think personally right now, a lot of hospitals and these clinics are hospital-centered, meaning their focus is on what I can gain, what can I get out of this, versus they need to be patient-centered. Like, why are we turning away patients if they don't have the funds for service? Why are we turning away people? Why are we watching someone die right next to us because they cannot pay for a hospital bed? So it's the mindset that needs to change. And I feel like that's the disconnect that's happening here.
And just to elaborate on that, pertaining to people using resources for their own gain,
right?
These are people that really need to revisit themselves. And then what we really need in Liberia is to maintain standard.
Yeah.
We don't have any standard, especially when it comes to our medical system. We need to have a code of standard that everyone...
And who do we hold responsible for that?
Oh, I mean, right now in my mind, and I might be wrong, I think it's the Ministry of Health.
Yeah.
Okay.
I think it's the Ministry of Health. Maybe, and don't get me wrong. Like I said, I really don't know when it comes to politics what what's supposed to be done. Maybe money's supposed to come from the higher up to go to the Ministry of Health for them to be able to do their job efficiently. But regardless, I think the Ministry of Health really need to set a standard, a particular standard that is across the board. So regardless of who you are, if you're not following that standard, you will be held accountable. And because there's no accountability, that's why everybody can do what they want to do. So if I have somebody that I have contact with, maybe in the states here that's supplying meds, okay, there's no accountability. You send my meds, I'm going to ask my sister who started going to school. She doesn't even know anything about medication. Open a pharmacy and sell this medication. So somebody coming in to buy medication, asking, why am I taking this medication? There's no proper explanation. So I gave the medication. I'm not taught about side effects, or what to look up for, or what to take, when I have the side effect, or so I'm just selling this medication because the goal is to get profit. But the goal is not centered around the person that's taking this medication, our patient, which of course supposed to be the center of everything. So again, once our standard is not put in place, we're going to keep finding ourselves. And Julia mentioned something about mindset. Yeah. Every time I go to Liberia, one of the things I keep hearing every time you try to introduce something new, man, that the way we do it here, man, that the way we do it here, you alone can bring change. You see, when we come out, like you and me, Julia, and all of Liberians who really have the country at heart, we've traveled and we've seen things done differently. Now, if we gather the courage to go back home and we want to introduce these things, I think people should try changing their mindset, and say, okay, and be open-minded to say, let's see how this goes. You know what I mean? I'll give you one example. During the COVID time when I went to Liberia, we used to go and take the COVID vaccine before we come back. And they had chairs lined, right? So this person sits, and then you go in, you talk to the person, and then the next person go to the next chair. So there was a lady that was coming to the seat, and she was standing, and the man said, oh, you have to move to the next chair. She said, I'm not moving to the next chair. What's the, cleanliness in that? That person was sitting in the chair. I don't know whether they contaminated it. And when he got no one clean the chair. Oh my God. About 4 or 5 persons jumped all over that lady. Who she taking herself to be? Oh yeah, that didn't want to come to America to think the special. They even coming from America to think the special. And it was just common sense, because you're talking about contamination, you're talking about spraying the disease from one place to another. If you have somebody getting up from this chair in front of me, you should have somebody cleaning it for the next person to sit on it. Because if you're not cleaning it, I'm not sitting on it because they've been blowing their nose. We all know people cough right in their hands, and they've been touching. So if I go and sit there, but they jump all over her. They jump all over her. It's the mindset, and sometimes Liberians, and again, I know people, I don't want anyone to jump on me, but Liberians, sometimes we're too content with our condition, with our situation. We feel like, okay, this is the way it is. This is how it's been for years. I'm not trying to change or move anything. We're afraid to change, but we should not be afraid, especially when it comes to healthcare, because it is important to every one of us. And I don't think, like you said, people getting married with you, I don't think anyone should get married with you, because it can happen to any of us.
Exactly.
It can happen to any of our family member. I think if I'm here, my family in Liberia is sick, my heart shouldn't be pumping blood because I feel that somebody will mistreat them. I shouldn't be taking somebody that has common diabetes from Liberia to send them to Ghana to go get dialysis, knowing very well that diabetes and high blood pressure is one of the prominent diseases in Liberia. So why don't we have enough dialysis center? Why someone have to go to Ghana? Nurses come from Liberia, they come here and they can't even pass, they have to start over because they don't take the NCLEX. What competency exam are we taking that, it's just too many things. Like I said, I get so, rather up when it comes to, healthcare and
I
stuff.
think we are all victims of a failed healthcare system.
Right.
And that's why we're so passionate about it. And in order for change to occur, we have to be willing to accept the change. And you made a good point. Liberia right now is not willing to change. They're very content with what they have. And it's just sad.
So my uncle comes
Yeah,
for
my
his dad.
father.
He comes here for his treatment.
He comes here for his treatment.
Every
and
6
that's-
months, you have to
Wow.
travel
and
it.
it's very sad because
Wow.
he's in Liberia. Why should you have to come all the way here to
Yeah,
get
I mean,
into
and,
it?
I mean, speaking of, people traveling all the way to another country just for, something
This is
very
treatment.
simple that can be treated right within the country.
Yeah.
Just the other day, the finance minister, I'm told he had an accident. He and his wife, and I hope by now they have recovered. And he was flown. Both of them were flown to Turkey for
Yeah.
treatment. But there's the same finance minister who tells the people that all is well and everything is fine, and he's scoring high grades in terms of financial policies and what have you. But he had a simple accident and he was flown to Turkey. And these are some of the things that are happening within the country. And the common man who cannot afford to go Sierra Leone or Guinea or Ivory Coast for treatment,
Right.
he or she would die as just from common, like you said, sugar or pressure or maybe even malaria. Because
Malaria.
there came a
Yeah.
time in Liberia, I don't know, but now because I've been out of there so long, not too long, but I've been out of there with a while. There came a time that if you were sick, right, and you went to the hospital, the first thing they would tell you, you either had typhoid without even checking you. They
Mhm.
will tell you had typhoid because you know what, the typhoid, the drip was so expensive, so they wanted to always sell the drip. So they would tell you you had
Right.
typhoid, and they would give you that drip whether you had typhoid or not. They would give you that drip. If they didn't tell you that you had typhoid and you had headache, they would give you not even headache, but or even checking you or whatsoever, they would give you paracetamol and tell you to go home. So it was either the typhoid drip or the paracetamol you were going home with. And these things, I believe, they're still happening. They're still happening. So the question is, I don't know if we have the requisite laws on the book. Like you all said, licensing and what have you, all of these things need to be put in place, to kind of checkmate all of the wrongs in the system. But I mean, from your own perspective, how can we go about, changing some of these makeshift ideology and concept mindset of our people if you were given the opportunity to say go down back in Liberia, and help to improve the system? What would be your strategy?
I'll say first, creating awareness.
Awareness.
Creating awareness that there is a problem, and then creating awareness that there is a solution with help. Definitely, it all bows down to competency and qualification, making sure that the people in the healthcare setting, our healthcare providers, are meeting these qualifications. So opening nursing schools that have up-to-date curriculum, that have up-to-date technology, ensuring that hospitals have up-to-date technology, ensuring that we are getting expired medication off the market, because why should family members be purchasing expired medication? How does that benefit them at all? There's so much, but I think for one is making sure that you bring awareness.
Yeah, awareness is a big thing, and not only awareness to the facility, but awareness to our citizens.
Yeah,
like they need to be aware of the common diseases and things that they can do to manage it before even going to the hospital. Like just for example, clean drinking water. I mean, how many times we say, oh, the person got cholera, oh, the person got, some kind of malaria. Just making sure that these preventable diseases can be, make known to people that if you do X, Y, Z, you can stop this from happening. Or this is the first step to, to certain things. So just creating awareness, one, for every individual, and creating awareness for this facility. Like in the States, they say, for you to be cured, you got to first acknowledge that you have a problem, right? So the Liberian people, all of us in togetherness, first have to acknowledge that there is a problem with the healthcare sector or the healthcare system in Liberia. And I think a lot of us know it, and those that don't want to admit it, they are just in denial for no reason, because we know that the healthcare system is just not up to standard. So we first have to acknowledge that there's a problem, and how can we fix that problem? What are some of the things that we can do? Health insurance.
Yes.
I think health insurance is a
Very
biggie.
good. I mean,
Can the government work on health
you
insurance?
just hit it. That was my next question.
Can we talk about health insurance? Because first of all, I think everyone working in the government sector should have health insurance, and then the government should make it compulsory for every private sector, every private organization that comes in that country and they have employees to provide health insurance. Because if I'm not getting paid and you tell me to go to the hospital, I don't have health insurance, I'd rather go take herbal medication. Now, do I know how much to take? Do I know the side effect, whether it's going to interact with another disease that I have? So a lot of people run straight to herbal. I'm not saying herbal is a bad thing. Again, our forefathers before were living with herbal.
But I mean, if it's not measured, it is not refined.
Exactly. They have measurement to these things. And ignorant, let's say when you don't know something, God protect you, right? But now we are in the advanced age. So medical insurance is a biggie. We need to have medical insurance. That's one of the things that I'm thinking about government-wise can work on medical insurance. Another thing is computerization of operation. I think that every system need to be computerized because there are a couple of things that it can do for efficiency. Not only efficiency, medication error. And then accountability, which is a big thing because if everything is documented,
people will be held
accountable. Oh, it was under this person's name that because she put a medication and gave it to that patient. So if that patient had a reaction, they're coming after her. They're coming to ask questions. But there are times that they gave medication, the person says, "Oh, I never gave her anything," and there's nothing to prove or not prove that that nurse or doctor did not give anything. So computerization of operation, those are things that we need to put in place for us to stop from somewhere. And again, I'm going to keep saying it. I know we've said it over and over. Training. We don't have trained nurses.
Human capacity or human resource capacity building and what if those are things that I talked about the entire last week. And it's so good you guys saying the very same thing that I've been talking about. Capacity building is very, very, very key. If the sector should be improved, that's one of the components that we need to look at critically. Improve the human capacity. And how do we do that? I was just giving a couple of solutions. You have those. You and I, we graduated from Liberia, right? We did arts. There were those guys like Peter Camel and all the other guys. They were very sharp in the sciences. Those are brains that you want to pick from high school level. Pick their brains, create the condition, the atmosphere where when by the time they should have graduated from high school, there are opportunities that they can go straight into those major sciences, and you mold their minds to going into the healthcare area. So that way, by the time they get into college, you already have a mindset. I want to be a doctor. I want to be this.
Right.
But you keep them within that system. And by the time they graduate from college here, you already ready for them to go abroad and get further studies. And not only keeping them there, because if you don't create the avenue and the condition or the atmosphere that when they go out, for them to come back and retain them, obviously when they go, they're going to stay there.
Right.
So get that package that when they go, it's going to attract them to come right back. So take, for instance, if they went and got maybe a master's in this field in the healthcare sector and you want to send them somewhere in ZU, there should be an atmosphere conducive enough to retain them. So that by the in ZU and they want to function, they would not think on going back Monrovia or going back, where they came from, but they will want to be there and work, satisfactorily. So you it's very, 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 very critical when it comes to our human resource or capacity building. It's very, very critical. And I'm just glad that you guys, threw a lot of light on that. So one thing again I want us to talk about, and it's the same thing, the same standard. I don't know if you saw it, but this is still going on where you have a pharmacist or someone who's supposed to be a pharmacist giving injection and drips. Did you guys ever experience that?
I tell you that for a fact. I've seen someone in school that's in school. I'm not even going to call name, but he's practicing to be a physician assistant, and he's giving drip at home, at the house. I'm like, why? How? Like how?
So I guess when you say creating like specialized field where this person can say I specialize in this, and they focus solely
On that,
that.
and besides that, not only that, again, come back to the root of stick, the guideline.
Yeah.
What qualify you to open a pharmacy? Do you have a pharmacist in that pharmacy? Because for you to have a pharmacy, like in America here, you cannot open a pharmacy until you have a qualified pharmacist working in that pharmacy, because that there's somebody that need to be able to explain that drug that you're about to sell.
I think to help with accountability is creating regulations for these pharmacies.
Regulation. Thank you. That's exactly that. You can't, any Tom, Dick, and Harry can just open a pharmacy and sell medication. Who's explaining? Because you know what? Sometimes when we're in the hospital, when I call my doctor, or my doctor gave a telephone order with a particular medication, and I'm not sure, the next person I call is the pharmacist to clarify. And he's going to give me a breakdown. Oh, yes, this medication is for XYZ, XYZ. Now, you can't do that back home. Because first of all, the person that even selling the medication don't even know how to pronounce the name, let alone explain what the medication is for. And again, I'm not trying to bring anybody down. I'm going to clarify that. I'm just saying that to help our people and to help ourselves, we need to know what we're doing. We can't just throw anybody, on the job. It's like hiring people and just telling them, you can do it. And we don't have proper, like, modern equipment. During the COVID time there were a lot of things about people not having oxygen.
Yeah.
As he was mentioning.
Right. We have COVID. This is respiratory problem. And we didn't have oxygen to service our people. Like how common is that? We didn't have enough oxygen. Like how common is that? And it's a sad situation that people die for no reason, that their death could be prevented. You know what I mean?
All right, so I'll hold before you right there. I want to read some of the comments that are coming out here.
Oh, okay.
I'll just read a couple of them, and then we'll get right back. So I have here Joshua K. Power. I'm going to put out what he wrote here. He said, there is nothing wrong with building as many hospitals as possible. We also need to encourage our youth to go in the medical field. It's unfortunate that everyone wants to study business, theology, politics, and sociology. That's Joshua K. Powell. So, and then he goes on to say here, this is James Powell Conan. So the two Powell here today. He said, I concur with you, Prezzo, but Liberia has been a one-way system in terms of career development and choices for careers. There are no private sectors for a lot of vast career trends. Secondly, Liberia has not been hiring people on career levels, but at degree levels. A person with a degree in health could be hired to serve as public work minister, a geologist, a gender minister, and list goes on. Back at UL, before enrolling, students used to have career orientation, but today you can. So let's start ready. Let's talk about this just for a bit. So what he's saying here, what the previous writer said was that erecting a lot of buildings is something that we shouldn't frown on. We should encourage it as much as possible. At the same time, we should encourage young people to be able to go in the medical field. So my take on that is, hey, have you created the requisite condition or atmosphere for these people to be attracted to the medical field? Because if, for instance, you have, and this is where the guy say I love to be in the political, but if you have a government that is seated and there's huge corruption going on where people steal taxpayer money in the millions, and there's nothing done about what is going on. You can steal thousands of dollars, and there's no penalty. There is nothing done about it. You go scot-free. Don't you think that I'm coming out of high school, I want to do politics so that when I get there, I can do the same thing?
Yep.
There's nothing attracting me to go in the medical field, because the first thing you go JFK, you don't have beds, you don't have oxygen, you have nothing to attract you to keep me there. the salary
You're not getting paid.
bill is very deplorable. I don't even think people making the administrators down and making up to $500. I doubt that. You know, and all of these things, there's nothing attractive there. So, do you think by the time I come out of high school, I want to go sit down to go do medicine or something that will keep waste my time for 4 or 5 years?
Of course not.
No.
What do you guys think about it?
Well, why
You hit it you kind of hit it in a nail. Like you need to
It's
make
not appealing.
healthcare desirable. Yeah, you need to make it appealing. For one, salary, right? It needs to be pleasing. Like if I'm gonna be doing all this work, I should have some type of compensation for it.
Sure.
Okay.
And this is the reason, because of what you guys said, is the exact reason because of what what's the last person, Power, his name was Power.
Yeah.
Power said that if I'm not quoting him wrongly, we're taking people that are not qualified to work in the nursing session and put them in the nursing session, because again, if I just train or aid for like 2-3 weeks, I can have her doing blood pressure and giving injection and giving medication and pay her little of nothing, and she'll be pleased, compared to somebody who, if I already go 4 years and you're going to pay me that chicken change, I probably would not do. I want to go Ghana or somewhere else to go,
exactly,
for my career. So yes, and that's why we have all these incompetent nurses or aides in facility, and they're really not doing the work that it's supposed to be doing because they don't know how to anyway.
Yeah, and I think the problem is a lot of people do have the passion to do the work, but imagine if you're working for a month, 2 months, 3 months, and you're not getting paid. You have family that you have to feed. You have to take care of yourself.
Yeah.
You're going to take a detour.
Exactly. So that passion is going to turn into something that's like, you know what? They'll see me when they see me. I'll do whatever I can do.
Secondary to breathing.
Exactly.
So Rufus King, he's my friend and brother. He's also a doctor. He said that proliferation of health facilities is due to greed from our professional friends. The entire health sector needs overhauling. Absolutely no regulation is in place. Anyone can bring drugs and sell and make money in Liberia. Until we can put mechanism in place, Liberia health sector will continue to be a mess.
That's very true.
I mean, he said it so right.
Yes, exactly.
So right,
we've been talking regulation, making sure you got things in place, making sure there's a standard in place that is across the board. Everyone should follow. There should not be any exception, whether you know somebody in the government or whether you know somebody in the Ministry of Health department. There should be no exception. If you set the standard, it should be across the board. Like having someone open a pharmacy that have no background for medicine, selling medication. No, that's a no. Take the people from on the street that's selling medication, especially controlled substances. How come not all our boys are taking volume and things just to get high?
Exactly.
Take the drug off the street.
Where are these drugs coming from?
Right.
Where?
Take the drugs off the street. I mean, it should not be sold on the street or in the corner. Why are we doing that to ourselves, to our people, to the young ones?
It comes down to regulation.
Wow.
Yeah, and those of us that prepare ourselves mentally and say, okay, we want to go back home to help to do something, create the avenue for. Don't make it difficult. Don't go and try to take everything from us on the table instead of creating the avenue for us to grow to help the country. It's ridiculous.
Yeah. All right. We're running out of time.
Right.
We could go on and on today, but it looks like I'll have to bring you guys right back. Maybe when you guys have the chance, so that we can elaborate further. But just
anytime, I think we need to keep doing it until we are heard.
Sure.
People need to hear it.
Sure. So two more things. So I will ask one more question, we answer, and then we'll go back to the school thing, because I want the people to know exactly what you guys doing, some of the good things you guys doing in the Virginia area there with the school, and how we can all because and we'll get to that. So just one question I have. So both for you, right? If you guys were given the opportunity to meet the Minister of Health today, what would be your advice? In terms of improving the system. If you were to sit before the Minister of Health, in a strategic meeting, what pieces of advice will you be able to give he or she?
Well, I can start.
Yeah, you can start.
My advice, I'll honestly take it back to competency, because although we have a lot of health services that are progressively being restored in the country, it's good. So we got to, take note of that. It's good. However, there's still several gaps. Liberia currently still have a very high morbidity rate. So what I would tell the Ministry of Health is competency and regulation, making sure that we are regulating the current facilities that we have running in the country, like putting them up to standard, making sure that there's some type of code that they are following. And it's not just them following that code one time, but it's making sure that there's repeated, consistent assessment to ensure that they are continuously up to par, that they're up to regulation. That would be my advice.
One of the things I would talk about would be curriculum, upgrade. Like, we need to change our curriculum. I don't see the fact that nurses are being graduating, and they are graduating and they're coming into the field not knowing what they are doing. They come into the States and they take the NCLEX exam and they can't pass. Yeah. They got to start. So there's something in that process. That process needs to be fixed, because if you go to school for 4 years, you should know the basic.
Yeah.
Sure.
So that particular process needs to be revamped. That schooling process. Well, we need to relook at our curriculum. Our nursing curriculum needs to be relooked.
I'm sorry, but I mean, you keep talking about the test that is given here. I think for the
we take the
that test. I mean, is it that different from what is being taught in Africa or Liberia, that when the people come here they gotta take it like 10 times before?
No, but the funny thing is so the countries that take the NCLEX, when they come here, they don't have to retake it, because NCLEX is one across the board. So if Liberia could revamp their curriculum and go to the NCLEX system, then if they take the NCLEX and they come here, then they don't have to retake it, because if they pass the NCLEX, I mean they are, satisfied.
Well, NCLEX is a computerized exam. This exam is testing your knowledge and patient safety. So it's not graded by hand, it's graded by the computer. And essentially how it works, when you answer one question correct, the question continues to get harder and harder and harder until the computer shuts off and says this person meets the standard for safety, patient safety. There's a lot of countries, there's a lot of people that I know from the Philippines that come from their country, and they sit to take the NCLEX exam, and once they pass the NCLEX, they can now practice as a registered nurse or as an NP in the U.S. So it goes back to
Liberia. They don't accept that. You have to start from scratch.
Yep.
So we need to look at that system. One, secondly, once you pass, it's not just about you passing. I think yearly there should be some process, some continuous learning process.
Yeah.
Because when it comes to nursing is very involved. It's evolving. It's changing all the time. So
the entire healthcare system is.
You have to keep yourself updated. You have to keep yourself updated, and that will fall back again to our system. Having modernized equipment, computerizing our system, all of that is going to fall right back into that. So if I were to sit with the Minister of Health, or on what you call it, health, right?
Yeah, health.
The minister, I am going to tell him, whoever that is over that portion should really look at our curriculum and see to it that our nurses, because I'm sure we have good nurses there, because nurses that come here and even just doing our CNA and MedTech, you can see that when you put them on the field, they're hands-on, they are really good hands-on, but it's the theory portion of it that they fall short. You see, so if you put them in that nursing home, they know how to do the job, they know how to run around, but the theory portion of it, they really don't have it. So because of that, some of them feel discouraged because they come here older and they're like, I'm not going to go back to school. There's no way. I have a friend that completed nursing in Liberia, and she came here and they're like, you got to start over. She said, hell no, I'm not going to start over. I'm old. I have,
Yeah.
Wow.
and I'd rather just be a CNA. But she's doing
Wow.
everything. Yes.
And he or
So,
she has that person has probably a bachelor's from back
she
home.
have a
Back home.
yes.
Yeah.
Wow.
But she it's
Wow.
not accepted here. And
Wow.
which is a sad thing. So put the proper system in place so that people coming on this side can't fall short. You know what I mean?
Yep.
So
Yep.
I think that's the best. That's one of the things I'm going to really push, because once we get a proper training, you're going to have nurses in the facility that really care about what they do, and they will pay attention to the patients.
Proper training and then also proper.
Well, folks, you've heard it. I've had these two amazing people in studio today, Mrs. Alice Kuhn and Juliet Civil.
Seville,
Seville.
Okay, Seville. Okay, Seville. Okay, so it's heavy. Seville.
you getting
Juliet
it? You getting
Seville.
it?
Okay. So you guys, this is Healthcare and You. I'm your host, Alvin D. McKay Sr., and we've been speaking on how best we can improve our system back home in Liberia, our healthcare system, and we've been touching on some amazing points. They've given us some good pointers, and I hope those who are responsible out there in Liberia, to be specific in our healthcare sector, will take note. We may not be close with the authority to enforce them, but I believe we are citizens, or we are concerned people, and we want all of these things to be improved in our system so that our family, our people back home can live longer.
Yeah.
And so, and even us, when we get back home for visit and what have you, we want to have a very, 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 very good visitation, where we are not worried when we get sick to rush back to America or other places. We want to stay right there and be treated properly, and so we want to speak on all of these things. So, like I said, we will be calling here some of those who are responsible from the healthcare ministry, some ministers, deputy ministers. Like she said, Ms. Kuhn said she knows the admin person at JFK. I don't know if he or she is still around there, but those are people that we want to be talking to. We want to get their side of the story firsthand, so that they will come and talk to us here about some of those challenges that they are faced with. We understand that these challenges will not be removed, like that, but it's a process, and we all can fix it if we redirect or remodel our mindset, to doing what is right. Because, like somebody said the last time, you said the abnormal things in Liberia, they are seen as normal, and so people just live with it, and people go along with it because they think that it's normal, but it's not normal. So these are some of the things that we will be speaking about. But I want to have both of you come back so that this time around we'll be talking about some of the laws on the book, and I hope we can go and do a little more research. We talk about what are some of those laws on the books, laws and regulation on the book, and who should we be holding liable for some of these things that are irregular within the system.
Right.
So the next time we'll have you guys come in, we'll be looking at some of those deep laws. Because, like I said, I was reading an article the last time, and I noticed that there is this health workforce program that was introduced by Ellen's government, and it's called the HWP strategy. This strategy runs from 2015 to 2021. So I think by last year, it ended last year. And this paperwork, this framework that was put together from any time to the current regime, this was a $30 to $35 million paper or framework that was put together to augment the healthcare system of the country. But guess what? You guys, we just talked about how the system looks. Does that system look like even worth $1 million? But these are paperwork they put together to augment the system. And I believe strongly, and I will do proper investigation and research. I believe strongly that these monies were given to someone, and there's no accountability. People eat it. People they do partial implementation, and there's no accountability or nothing. And part of this project was to train 6,000 healthcare professionals. Can you imagine that? 6,000 according to the document, according to this paperwork. 6,000 professionals. Then besides that, in addition to the 30 million that should have been given, there's additional 45 million for infrastructure development. So I guess this the part of the 45 million that government passing around building makeshift structure for hospitals and all of these things that are going around. But we will dig deeper and we'll get some of the information. But I want to call you guys back whenever I have the chance so that we can talk on some of these regulations that government have that they are not enforcing, that causing the system to be so weak, and how best we can start holding them accountable. Those requisite agent people in the system, that we can hold them accountable so that they can start looking at some of these simple, like I say, it's not rocket science. It's just simple things that they can be looking, that they can do to ensure that the system gets its due diligence. So I will give you guys in the next 5 minutes to just talk to us about the unique
health school.
Unique health school. I'm so sorry.
Okay,
Mine is getting blacked out now. So unique health school. Still, you guys just tell us the good things you guys are doing back there with unique health school.
Okay, nice. Well, for starter, Unique Health School was established by our director of nursing, Miss Alice Kuhn. She saw the need for a secondary institution in her community. So we're located in Manassas, Virginia. We currently offer several programs to our community. We offer licensed practical nurse, certified nurse aide, registered medication aide, as well as patient care technician. So we have a lot of programs that are running back to back simultaneously. And our students, they get theory, and they also have the opportunity to go to hospitals within the area, within the Virginia, I would say the entire DMV area. So Virginia, Maryland, DC area, to actually put to work hands-on practical. Our students love us. We love our students, and we just want to give back to our community. We are very passionate about healthcare, and our passion, we want to make sure that we share with other people. Do you have anything to add?
No, I mean, she basically said it.
So do you guys run like anything online?
Yeah, so good question. So we have both, it's hybrid. So we offer courses online as well as in person as well.
What are some of the courses you do online?
I'm sorry?
What are some of the courses you do online?
So the courses that we do online is our certified nurse aide program, so our CNA program, as well as our registered medication aide program.
So if I'm to call today and say, hey, I want to become a certified CNA, I can do it online and get certified, or it has to be limited within your Virginia or the, how you call it, the BM or DMV era?
No, so we'll actually tell you to come on in. We'll make sure that you go throughout our course. Once you're done with our course, we'll actually prepare you for you to sit and take the state exam. So once you take the state certification exam, you are then certified. And in that way, if you were to move out of the DMV, you can still practice as a CNA, as a registered medication aide, as an LPN. So we do.
I can sit in Columbus now and take the course.
So let me elaborate on that.
That's the question I'm asking.
So the CNA, the Certified Nursing Aid program, it's a 5-week program.
Hybrid.
Okay. So the first hybrid. So the first 3 weeks is online. You can sit in Columbus and do that. Okay. But again, like you see, we've been talking here about training.
Yeah.
You would need to take a drive down here for us to do the practical
hands-on
in a couple of days. So you can come down for the weekend. We normally work with you to do your hands-on, because we need to know that not only you were reading, because you could have anybody on a computer.
Exactly.
But once you come in now, we're going to evaluate you. First, we're going to give you a paper exam, and then we're going to evaluate you in the lab and give you certain skills that you need to know. After which you can take the computer test, and the computer test you can take it at home, or you can take it in at the facility. And then after that, you have to go for the state exam. Now, once you get a state exam, you can take it back to Columbus, or where you are? Ohio, right?
Ohio, yeah.
Ohio, you can go back to Ohio, and you can work as a certified nursing assistant. Yes.
All right. Okay. All right. So thank you all so much. I really appreciate you taking up your time to just share with us your knowledge about the healthcare system. And trust me, I've had an amazing time. I'm sure the folks out there too, they've had an amazing time, just receiving from you guys those information you put out. Like I said, please, I will be on you guys back again to bring you on, so that we can talk on this time regulations
So
and those
before you
laws
go,
in the
before
book.
you go, Alvin, I just want to throw in something. I told you that I go to Liberia twice a week.
Okay.
Not only did we, we also teach for the American Heart Association,
Okay.
CPR. So me, I'm going to try to get some equipment. Maybe one of the times that I'm going down there, if I can link with some of the facility and give them their
CPR
staff
program.
free CPR. I definitely will be able to do. I just need to know who to
That
talk
would
to
be
and
amazing. That would be amazing.
to be able
That
to
would be
do that
amazing.
because we need it.
Yeah.
The people need it, or the health staff.
Yeah.
I know.
They do need it.
But thank you all so much. I really appreciate
No problem.
you
Thank
taking up
you.
your time.
I appreciate that.
This has been your host, Alvin D. McKay Sr. This is Healthcare and You. This is the platform where we discuss healthcare related issues that are affecting our world that we live in globally and nationally. So again, thank you so much, Ms. Kuhn and Ms. Saville or Saville. I got it right, Saville. All right. Thank you all so much for being a part of today's program, and we look forward to seeing you. Not too distant future. We'll have you guys come back here if you have the time to just share with us what you've researched and your knowledge on those laws that are on the books back home, because there are laws there, there are regulations there, but I think what happened is that we lack the implementing
Implementation portion. Yeah.
So I think we can talk a little bit about that and bring some of those people here and let them talk to us also. But again, thank you all so much. I really appreciate your time.
No problem. Thank you
Time
so
to
much.
spend with
Appreciate it.
Thank you.
And God
It's a
bless you.
pleasure.
Have a wonderful week.
You too. Bye.
God bless you.
Thank
Bye bye. All right, folks. So again, this has been Healthcare and You. This is your platform where we discuss healthcare related issues. And today we have with us Mrs. Kuhn and Mrs. Saville. They both were here today just sharing with us their knowledge on the healthcare system back home in Liberia. And you heard for yourself, people. You heard for yourself how our system is so messed up. It's so messed up, and like one of our listeners said, Mr. Rufus King, he said, yeah, the system is so messed up because of greed. People are greedy. Those who are in authority, those who are in the position to have access to these medication and the equipment and stuff, they take them to their personal businesses, and they leave the appropriate um, the appropriate structure like JFK, Redemption, and other places that should be having these medicine and what have you. They leave them empty and take them home to their pharmacy and to their personal clinics just to make money. And these are all wrong. They are wrong, very wrong. And so we have to speak up against some of these things that are going on back home. And so I just want to encourage us to let's talk about these things. We're going to be here. We're going to be holding those who are responsible. We're going to be calling them to book. And of course, I hope my own friend and brother Rufus, please, I will call you up so you can be one of our studio guests here very soon, and you can talk to us because you have your hospital back home. I'm sure you will want to throw light on some of those happenings back home, some of the challenges that you are faced or your hospital is faced with, and what have you. So we will be looking forward to seeing you here on this podcast sometime soon. But if you just joining us, there has been Healthcare and You. We've been providing you informative information on those burning and critical issues regarding the healthcare system of Liberia. And like I said, we're not only going to be looking at Liberia, we're going to be looking at other systems around the world where we think improvement can be made. and strengthen. So again, this has been your humble host, Alvin D. McKay Sr. It is Healthcare and You. We are here every Monday, 5 p.m., Wednesday, 5 p.m., and Fridays, 5 p.m. Eastern Time. And so again, thank you so much for being there. God bless you. Do have a wonderful, wonderful, wonderful rest of your week. We look forward to seeing you here on Friday. Friday, we will have another studio guest, I'm sure. All right, I see. Okay, brother, Mr. Rufus King said, he said, I will be glad to participate, my brother. Okay, so I'm gonna reach out to you right after the show, my dear brother. Maybe you could be here on Friday, for as one of our studio guests. So again, thank you so much. Have a wonderful rest of the week.
I think the easiest way